So I am Ashley Dehart. I'm the administrative coordinator for health information as well as counseling and disability services and integrated advising. We're located in the lower level of Rotary Hall in the Student Support Center. Health information, our office is, we provide over-the-counter medications for students and basic first aid. We also help with referrals to local providers if students need to see a medical provider off campus. We also help with the EIIA benefit plans that we have for students, and I'm willing to go into that if you all have questions. And we also collect all the immunization records for all the incoming students each year. So that's what health information is in a nutshell in a normal year, definitely.
All right.
So.
And thank you. And I'm Mark Miller. I'm the Dean of Students. So I oversee health information and also a number of other student development offices, and then also have been one of our campus leads for our COVID response as well. So we'll start by going, Ashley's already talked a little bit about health services and health information, what we normally provide in a normal year. So obviously we'll still be providing all of that. The big health question this year obviously is COVID-19 and how we are trying to work to keep everybody safe with that. So that's where we'll spend a majority of our time on the call today. We'll be going over some of our different safety protocols with you, and then also asking questions as you have questions. And again, as I've said before as well, please feel free to put questions into the group chat at any time. And also, if you have a question, we also will have points where you can unmute yourself if we want to just talk and ask questions that way as well. Can everybody hear us okay? If anybody, please unmute and tell us, or put it in the chat if you're having any trouble hearing or seeing us. Okay, all right, well, sounds good. All right, well, Ashley, so is there anything else that you want incoming parents or students to know about immunizations or health services, health information, I mean?
In regards to immunizations, we are just asking for all of the students to submit their vaccine history. The link for that is on the SOAR website. It's also on Centenary's main website for accepted students. You can find the link in the new student checklist. We follow the requirements for the state of Louisiana, and they require 2 measles, mumps, and rubella vaccines, a meningitis vaccine after the age of 16, and then a tetanus booster within 10 years. So all of that, we need to have all of that information before classes start. So if they haven't submitted it, do so soon. We also sometimes have some issues with students entering information incorrectly into the form. It's just a little confusing when you're looking at all your dates on your vaccine history. So if there's something that's not correct, they'll receive an email from me asking to either resubmit it with the right date or to get an updated booster. So I am in contact with the students as they're submitting those immunization forms. So just have them, we just need them as soon as possible before classes start.
Great, and that's a state law that we have to collect all that immunization information for students to be able to enroll at Centenary or any other college in Louisiana. So fantastic. And then can you just give a very brief overview of what the what our wellness benefit is through EIIA for all students, kind of whether or not they need their own insurance, and what our benefit that we've already purchased for everyone does for people?
Sure. We have 3 policies that we have. There's an accident, sickness, and then there's an athletic policy. Generally speaking, these plans are meant to supplement a primary insurance. So we do ask that if they are on your health insurance plan, to keep them if possible, because this plan does supplement that. It really is kind of like a secondary policy that kicks in. It helps with deductibles and co-pays. It can help with medications at a pharmacy that you can get reimbursed for all of that. I'm the point of contact for all of that. So if your student is feeling ill one day and needs to go to an urgent care, I can help them with the claim form and the process and all of that. But it is meant to supplement a primary insurance. If they do not have insurance, it can kick in and kind of cover as a primary, but there is a cap, there's a limit. It doesn't cover everything, but it does help with some out-of-pocket expenses if needed. So
that's right. And I think, and that cap is pretty low as well, right? So it's not intended to be insurance.
No, it's a $5,000 limit per incident or illness. So it definitely does not cover major medical stuff. So.
Okay, thanks. Yeah, so our recommendation would be that everybody comes with health insurance, but then what this should do is to cover all of their out-of-pocket expense. So if they're on your coverage, but say you have a $50 or $100 copay, they could go to urgent care, they can go to the doctor, and they won't have to pay anything out of pocket, or if they do, they'll get reimbursed through our benefit. Does anybody have any questions about those 3 different policies that we provide that help supplement insurance to make sure that everybody has some coverage? Okay. All right, Ashley, is there anything else that you want to cover about health information not related to COVID before we jump into?
Just that we're here. If a student, kind of busts their knee or has a headache or something, we do have over-the-counter medications that they can come and get. We don't have a medical provider on staff currently, so it is at the student's discretion for all of that. But we have Band-Aids, ibuprofen, stuff like that can kind of help with bumps and bruises and things. So yeah,
as people probably know, Shreveport's a fairly major medical hub, and so we have sent a very, very high percentage of our students to medical school. So there are centenary alumni, doctors everywhere, and urgent care facilities and hospitals easily there. So rather than try to treat people in a campus health clinic, we think we provide much better care by providing the benefits so there's no out-of-pocket cost, and they can go and see a place that would have all of the testing capabilities, x-ray capabilities, things that we wouldn't necessarily be able to provide in our own clinic. So, okay, so let's talk today a little bit about COVID-19. I suspect that that's where most of the questions are, but I think someone has a question first. Let me go ahead and I'm gonna unmute you so that you can ask your question.
Okay, my daughter is possibly coming without a car. If she is sick, is there any way to help with transportation to a doctor?
There are, yeah. So we're not allowed to transport in university vehicles for our liability reasons, but we have, usually they're able to find a ride very easily because most students do have cars. And we also have some money if people need, if they can't find another ride, if they need a taxi or ride share, we can get someone to bring them to the doctor.
Okay, thank you.
Good question. Okay, so everyone should have gotten an email recently with a link to the Centenary Forward Safely Promise. Forward, you'll hear a lot. It's a line from our alma mater, Forward, Forward Centenary, in our song. And so we use that as a number of different ways. So if you go to our website, you can see it as well. It's on the main page, and every page, there's a thing to the latest COVID-19 information. And then once you get there, you just click the bottom left-hand corner in the menu. It's Forward Safety Promise. And you'll see the Forward Safety Promise for Centenary students. So the thing is we spent months and months consulting with CDC, consulting with the local health department, consulting with physicians, and thinking about how do we make our campus as safe as possible. But the honest truth is that we really need cooperation from every person in order to make that work. Even just a handful of people who are doing really high risk things can spread a disease to other people. And so we're asking all of our faculty and staff and students to sign this Forward Safely Promise when they come back to campus. And it outlines kind of what our expectations are. So we'll start with coming to campus. The first one is that we ask that everybody try to reduce their potential exposure during the 14 days prior to coming to campus. So now if you're the parent of an athlete or a choir member, that's now. They'll be here in about 2 weeks. And so during that time, again, avoiding large crowd, maintaining social distancing, washing hands, trying to avoid contact with anybody who might have the virus. So, so that's sort of step one, is that starting now, we need all of our students to be being just as careful as they possibly can. Part of our idea is we are going to be testing all of our students as they arrive. And so the idea is to try to get our campus as COVID-free as we can, and then to minimize the amounts of contacts off campus that could introduce the virus into our campus. All right, so along those lines, also when people come, I'm assuming many people have already been to SOAR. We'll be doing some similar things as with SOAR. And one of those is that we're gonna ask everyone to do a self-check and to take their temperature before they come to campus. And then when you arrive on campus for move-in, we will also be temperature checking everyone as they arrive. And so anybody who is sick or has a temperature is not going to be allowed on campus. So again, please check that. The worst would be if somebody drove a really long distance and then we had to turn them away because they were feverish when they got here. So please check that before you leave home, and then we'll sort of do a double check. If worst case scenario, if someone, say they develop a fever during the trip, something along those lines, we would let the people who don't have a fever go ahead and get that person moved in, but then we just ask that people wait until they're healthy to come back to campus. We are going to have our classes. All of them will be available to where people can, or 98% of them will be available to people if they need to take it at distance for a period of time. So if somebody did come in, they had a fever, they weren't able to move on campus, or even had a positive COVID test, they wouldn't get behind. They could still go to class virtually and remotely, and we'll still get them caught up, and then we'll welcome them back onto campus just as soon as they're not a danger to others. Okay, so along those lines, again, we will be testing people as they get here, but would ask that anybody who has had a positive COVID test within 14 days of the, has had COVID within 14 days of the time they would be coming to campus, that they do not come until they have been, until at least 14 days have passed, including at least 3 days with no symptoms and no fever. So at the end. And if people have had a previous test for COVID, we're probably going to test them anyway. The only time we wouldn't test them is if they have had a fairly recent positive test. So if 4 weeks or 6 weeks before you get to campus, you had COVID and then are now don't have COVID anymore, at that point, we know that there's some immunity. We don't know exactly how long it lasts yet, but we are very confident it lasts for at least 6 weeks. So, but almost everyone is gonna be asked to test for COVID as they arrive. So again, guests and people moving in won't be tested for COVID. They'll just be temperature checked, as will our students. But then all of our students and all of our faculty and all of our staff are going to be tested, and we will have free testing available here on campus for those students. Does anybody have any questions about the process of coming here to campus or the Forward Safely Promise? Okay. All right. So one of the other things is that we have a number of things that students are required by policy to report. Ashley, you want to talk about reporting?
Sure. We are asking students if they are experiencing any symptoms throughout the school year or possible exposure to someone who has a positive COVID test, to report that to Mark, myself, and Montgomery Muirs, the Director of Residence Life. And then athletes are asked to report that to their coach or trainer. So we're hoping just to have all of that, you know, kind of funneled through the three of us so that we can then handle it as it comes in. So any student just needs to let us know if they're not feeling well. And then we will then refer them to an outside source to go get a COVID test, I believe, right, Mark?
That's right.
Okay.
Yeah, we have had students living on campus ever since March, continually. We've had groups of students here. This whole time we have only had one student who has tested positive for COVID, and that person did not spread it to anybody else on our campus. That person was living on campus in a residence halls. But for this to work, again, we need everybody to do their part and to report quickly and promptly so that we can get people isolated so that it doesn't spread. So that's our next section on our quarantine and isolation policies. So anybody who has symptoms that are consistent with COVID, so a cough, a fever, or other multiple symptoms, we will ask to, we're asking everybody, first of all, to every day to do a daily self-check. There is a self-checker on the CDC website. We're also looking at the possibility of getting an app just to make it even easier for students. So every day what we ask is that students, when they wake up in the morning, that they just sort of say, hey, am I feeling okay? Do I have a fever? Am I sick? They do this real quick self-check. And if the answer is that they are sick or they're at risk, then we'll ask that they get to an urgent care center or to their physician and that they get tested. We also will ask that they self-quarantine themselves for 14 days to make sure that whatever they have that is making them sick, that they don't pass to anyone else. Similarly, if someone is in contact with someone who turns out to be COVID positive, and by contact, we're using the CDC definition for that, which is to be within 6 feet of that person for 15 minutes or more. So as people arrive on campus, we'll also be asking them to track all of the people that they're in contact with, so that if we do happen to get a positive test back, we know anybody that they might have interacted with, and anybody that they interacted with will then need to isolate for 14 days. To make sure that it doesn't spread. So if somebody does test positive for COVID, then they'll need to self-isolate for at least 14 days. And then we'll be able to come back into the general population once they've isolated for at least 14 days and have been symptom-free, including no fever for at least 3 days, not on medication. So for isolation and quarantine, self-isolation, they've got two choices. They can either, if they are living on campus, they can either remain on campus or they can go home. We will just ask that they do one or the other and stick to it. If they do choose to isolate or quarantine on campus, we will make sure that we provide a private room for them to do so in there. We'll deliver all of their meals to them. We'll check in on them daily and make sure that they are doing okay. But they will have to follow all of our rules and restrictions, which in general means staying in the room except when they're leaving for medical care or under other very rare circumstances. Again, just so that there's not any danger to other students. If students prefer to go home, they're more than welcome to do that as well. We will help them. We found that testing is, especially we have a partnership with Osner in LSU Medical Center here in town. And so we have better access to testing, I think, than some places. So again, if they need to they do need to get tested, we can help them do that in Shreveport. But if they can get tested in their hometown, they can do that as well. Yeah, so good question. If a student is quarantined, how do they get care? So that's one of the exceptions where we would, where they can go to get medical care. We can provide them with a thermometer, and when they're self-isolating, we actually can go and take their temperature twice a day. Once they have a positive test, then we would encourage them to take their temperature themselves. And then if anybody becomes more seriously ill, which is very unusual with young people, but can happen, then we will keep checking on them every day, a couple of times a day from distance, so via phone or text, and then would encourage them to get to an urgent care center or would call an ambulance if somebody was having trouble breathing or anything that looked like it might be getting more serious. All right, does anybody have any other questions about our quarantine and isolation policies? So we have a number of houses off campus that are within a block of the campus that we have. We'll be using those as self-isolation spaces for people who are COVID positive. We also will be using empty rooms or single rooms in the residence halls. Yeah, good question. So the question there is, what if a student has COVID symptoms but hasn't been tested yet, and what about the roommate? So if they have COVID symptoms, they would need to immediately start self-quarantining for 14 days and to get tested. And if their roommate has been exposed to them and but doesn't have any symptoms, we would allow them to move out into a different room so they couldn't get continued exposure. And then if that person ended up testing positive, and they would also isolate. If that person ends up positive, then that person would also need to get tested and isolated. If that person is negative, then they would be fine. And they would just stay out until that person is feeling better. We have added additional filtration. We have added hospital grade filtration to a lot of our buildings. Our buildings vary. And so for example, Klein is open to an open air courtyard. Its ventilation system is a little bit different. And so the ventilation and filtration will be a little bit different in each building. But we're consulting with the local health department to ensure that, that all of our facilities are safe. What we know is that it passes through aerosolized drops. It doesn't tend to travel from room to room, but it's possible that it could in laboratory conditions. And so we're trying to be cautious of that as well. Any other questions? All right, so we're sort of talking about safety in the residence halls as well. We're a little bit lucky on this. So our largest residence hall on campus is going to hold less than 200 people, which is kind of where other people are trying to get their residence halls to. Also, we don't have any community bathrooms, so no bathrooms down the hall. So again, we think that we're going to be in pretty good shape there. We will be closing some public areas because what we know about the virus, or we think we know, is that although it's theoretically possible for it to transfer, say, on a piece of cardboard or surfaces or other things, we know that the vast majority of the transmission is from person to person. And so we're going to be doing enhanced cleaning of all public surfaces. We're also going to be shutting down or restricting access to some public areas like kitchens. But the big concern really is just keeping people from gathering in clumps together. And if they are gathering, to make sure that everyone is wearing a mask. We've also been talking a lot about our cafeteria procedures. We are going to be putting in procedures that are significantly more, significantly stricter than in local restaurants. So we will be having a return to in-person dining. We had restricted that in the spring. We're going to be, our dining hall is going to be restricted to no more than 50% capacity. Tables are going to be spaced 6 feet apart. And so the dining hall will be capacity controlled. So that's something, again, for students and parents to realize, is that when students come, they may be told, I'm sorry, we're full. We don't have any more space at this moment, especially during the lunch rush for in-person dining. But then what we're doing instead is we're going to have a really robust takeout options where we'll have some grab and go meals. We'll also have to-go meals. And so when they come to the cafeteria, say there's not enough space for people to sit in the dining hall, they would be able to come in, go around, gather all their food, and then to go out and eat on the picnic table outside, or to take it back to the room, or take it to the porch of their residence hall to eat outside. So they'll still have access to the same food, or they can just do grab and go, where they just come in, swipe their ID. They'll have a number of meals, both hot and cold options. They can just grab those and walk out with them. We'll also have our Randall's Grill, which will be open where they can get coffee or other food. Again, we're going to be capacity controlled in the seating area, with the idea of trying to not keep, since people can't wear masks while they're eating, trying to keep people from gathering in large groups close together. What we are looking at doing, it's not in place yet, but we are working on right now, is doing an ordering app that would be linked to our cafeteria menu, where students who wanted to get food to go could actually go on the app, and instead of just taking one of the hot meal choices, they could order exactly all the items that they wanted, just like you would, if you're ordering on Grubhub at a restaurant or something. That would all be prepared for them, and then they could just go pick it up and take it with them. So that's what we're working on right now. Also, again, people who are in isolation or quarantine will be delivering meals to them twice a day, so that way they still have good access to food. Any questions about the residence halls and cafeterias?
Amy asked, is it covered or buffet style?
Yeah, so typically we would have done buffet style, but now all of the food is going to be behind the line, and students are not going to be permitted to touch any of it or to serve themselves. It will all be served. So they'll say what they want, and it will be served to them. Initially, we're going to be starting all on one-use paper and plastic until we sort of get the flow ready, but we want to get back to using China. Just the students wouldn't be able to touch anything, it would be handed to them. We have a commercial dishwasher that sanitizes everything at a very, very high temperature. And so the China is not a concern. The concern is with people grabbing their plates and touching other people's plates, or grabbing a cup and pulling one cup off of another cup. So to start, we're going to be doing all one-use serving utensils. But again, once we can get people sort of trained to where they're not touching things, then we'll go back to using silverware in China. Okay. Well, then the last thing that I wanted to just sort of clarify is just fairly recently, in response to some requests, we've created a remote student option. And so there are some students who are choosing to take classes entirely remotely. This would be the option only for people who want to really minimize their risk. And so the remote students would not be setting foot on campus. They wouldn't be participating in activities. They wouldn't be interacting with our students, wouldn't be doing anything with them. So that's one option. But then we also have a local commuter option, which is very different. That's if people are from one of our local zip codes and are planning to live at home with their parents, then they would be in local or commuter status. And so local or commuter status is exactly like residential status, except that they can't go in the residence halls. So if you are planning to live locally at home with your parents and commute, then again, would just ask that those people be particularly vigilant about the forward safely promise, because again, anytime people are going off campus, they're not only exposing themselves to other potential virus vectors, they're exposing themselves to vectors that aren't already on our campus, and we're trying to restrict that travel flow back and forth. And similarly with the remote students, if those students are going to be 100% remote, we just ask that they stay at 100% remote so that they are being safe, and also so that they're not introducing anything else onto our campus by coming back and forth. Okay, those are the questions that we had gotten before the chat started. And so now we'll just sort of open up to any other questions that anybody has related to COVID or health information.
Amy asked another one about additional hand sanitizer stations. I know that there were a lot, and how many, but I know that there were a lot installed on campus.
Yeah,
common areas and
yep,
that.
That's right. So we have hand sanitizers all over campus. We also have every office on campus got a cleaning kit, and we're also going to have sanitizing stuff so that when students go to class, every time before they start class and after they leave class, they'll sanitize their area. In terms of the online only plan, information I think is going out on that. Sign up for that starts on Friday. So I think that there will be some more information going out about that between now and then. Yeah, that's a good question. The handbook will be updated before we start on August 10th. And so, so that we are actually meeting about that on Wednesday, and that'll be updated before we start classes. And the question about the mask mandate, our mask requirement will likely remain in place indefinitely until we can determine that the risk of COVID exposure and spread is very low. So our mask mandate will be going, even if the governor relaxes the mask mandate elsewhere, we will still keep the mask policy here until we think the danger is very low. Yeah, and the 2 days, so college students usually don't get up and eat breakfast anyway. And so again, we would be serving brunch and supper, and then we'll be able to provide them with hearty enough meals that would be more than enough. They also could still have things delivered if they wanted to order groceries online, or if they wanted to order snacks or pizza or anything else like that. If they're in a residence hall, we would ask that they have that delivered to outside of the residence hall, and a staff member will come and drop it at their door. If they're in a house off campus, they could have that delivered and no contact directly to the house. And we can assist them with that ordering process if they need. Yeah, that will not be the case, that they will not. So in the spring, when we first redid the policy, we said that if they left town, that then they couldn't come back. Essentially, we're asking everybody to either stay on campus or to go home, but not to go back and forth. We have an updated travel policy. And so again, when people come, if they have been exposed to COVID, we might ask them to self-isolate during that time or self-quarantine, but they would be able to come back and forth. We would ask that people go back and forth as little as possible, but they would be able to leave and come back. I'm glad you guys are reading the student handbook. And again, it's unfortunate in some sense because we haven't updated it yet because for the new year, but it gives me hope that people are actually reading the stuff. But that will be updated before our classes start. Anybody have any other questions? And again, you can either just put them in the chat or you can unmute if you want to speak. Okay, Ashley, do you have anything else?
Just if your student hasn't submitted their immunization records, just try to get that in as soon as possible. Like Mark said earlier, that's a state law that we're required to collect all of that, and it could hinder them starting classes potentially if we don't get all that information in. So that's my most pressing thing right now. So.
Okay. Well, thank you all for the great questions. Thank you all for being here and participating. And if you do have any other questions, again, Ashley Dehart and Mark Miller, please feel free. Our email addresses are just first initial and last name at centenary.edu. So please feel free to contact us if you have any other questions. All right. Thank you, everyone.
Bye.